Thanks so much. All right, so let's go through this. In health news, this weekend saw the third day of consecutive increases, including 1,100 deaths in the United States. Testing continues to be a top concern for reopening the economy, which goes hand in glove with a vaccine. The U.S. government is investing millions in both, and we've been covering this and following this issue closely. We also see and are anticipating a looming shortfall in healthcare professionals. In economic news, the current weekly unemployment rate is unemployment is 32 million. This is compared to the worst of the Great Recession at 700,000. So again, weekly unemployment at 32 million versus 700,000 back in 2009. So around 1 in 5 American workers are collecting benefits. Again, I mentioned as last week, this week, the eviction moratorium has expired at the federal level and there's no federal stopgap currently. In legislative news, though, we are anticipating that the Republican deal will come forward today. It was delayed last week as a result of inter-party conflict around primarily federal unemployment benefits, payroll tax cuts, and the $1 trillion in spending. So we're closely following that and seeing where that comes out. And I'll talk a little bit more about that in my third slide. And then finally, it's likely that we're going to see, in this round anyway, for the CARES Act, another $1,200 in stimulus checks, liability protections for businesses, money for schools, and then money for testing, and then also reemployment. On the second slide here in Pennsylvania, cases and deaths continue to rise, and the PA Department of Health is seeking more healthcare workers. Again, we mentioned this in the federal slide as well. Governor Wolf signed several bills into law, including HB 1459, which establishes mental wellness and stress management program for emergency responders. We talked a little bit last week also that Pennsylvania is one of the few states that has hazard pay, that has already passed hazard pay into law as well. Unemployment rose last week in Pennsylvania for the first time in 3 months. Governor Wolf is also looking to or seeking federal monies to help PA restaurant workers. As we've covered in the past, 40% of restaurant workers in Pennsylvania lost their job during COVID-19. In Allegheny County, the rate of cases has been slowing, although 1,000 cases were reported last week. The Allegheny County Department of Health announced this new COVID-19 field response team last Thursday. And so this team consists of around 10 members, and they're going to visit businesses in the community and check to see if establishments are following business safety precautions, including a universal masking order, as well as things around bars and restaurants, occupancy restrictions, physical distancing requirements. Also, Pittsburgh received a call last week among 11 other major cities that were called by the National Coronavirus Task Force, Dr. Deborah Birx specifically. In the call, the National Task Force asked that Pittsburgh and other cities, including Cleveland, Baltimore, and Miami, do more in terms of aggressive steps to mitigate the severity of the current outbreak. And finally, on slide 3, I wanted to just kind of bring you all into a bit of a scan that's been going on sector-wide. And, obviously here at the Forbes Funds, we're continually following the health and the well-being of all the different 501c3s and other organizations within the sector. This study specifically focuses on 501c3s and comes from Candid. And so it shows that around 11% of nonprofits could close without federal action. 501c3s, as we all know, are the third largest contributor to the private sector jobs, with around 12.5 million employees nationwide. 1.6 million jobs, however, have been impacted between February and May. And there was also a 90% revenue reduction during that, 90%, saw a revenue reduction during that time. The study also poured through tax filings at 315,000 501c3s and showed a wide variance between 3% and 38% could go under. However, the findings weren't all negative and showed that most nonprofits will weather the storm. Additionally, there has been an uptick in generosity with $11.4 billion that, thus far specifically designated for COVID-19 responses, and then a 27% increase between 2020 in racial justice work versus the past 9 years. And so that's shown in the exhibit below. Regarding advocacy in the next CARES Act round, the National Council of Nonprofits penned a letter to Congress asking for 4 specific items. This includes emergency funding program. This would including extending and expanding PPP. Excuse me, sorry, my cat's on my desk. Continuing emergency funding programs, which would include extending PPP, Work Now program, employee retention, tax credits, and other appropriated funds. Number 2 would be providing low-income loans to medium and large-size nonprofits to gain access to federal funds. This would authorize the Federal Reserve specifically to finalize language that offers loan forgiveness for medium-sized nonprofits and lifts the loan cap as well. Number 3, strengthen charitable giving incentives using the CARES Act to increase the universal charitable deduction above 1/3 of the standard deduction for and extending that into 2021. And then fourthly, providing full unemployment benefit requirements. And so this is part of the panel request that we talked about in the previous couple of weeks to support federal unemployment insurance reimbursements for self-insured nonprofits at 100% of costs. That kind of wraps it up here. I know I covered a lot. We really wanted to be focused here on nonprofits this week and kind of how everyone's doing. And I wanted to just bring into context where we're at nationwide as well. So with that, I'll turn it back over. Thanks a lot.